Matthew Holt. It's a quick bite from the show floor of health. This is Ashish Shah. He is the CEO of Dina, and Dina is a care coordination engine for home care and post-acute care. And Mike, this is where you're supposed to tell me what you actually are.
Yeah. Well, thanks for having us. Dina's we coordinate care at home programs for large provider groups and health systems and health plans, in particular Medicare Advantage and Managed Medicaid.
All right, so that sounds very trendy today, right? I've already talked to people who are doing hospital at home. There's a whole bunch of stuff. So Signify just got bought, and they were doing interviews and visits to the home. There's a whole bunch of stuff going on in home care.
Yeah.
There's people like Dispatch Health. Can you explain a bit about what is the precise role that Dina plays?
Yeah, I mean, really, there are two simple use cases. When we're working with large health systems, it's helping a patient who's been in the hospital safely return to home with durable medical equipment, perhaps some skilled nursing services, and other type of support to make sure that they progress properly at home versus skilled nursing facility. We provide all the tech infrastructure for that. That same tech infrastructure is also used by Medicare Advantage plans to help coordinate in-home services regardless of a hospitalization. So think non-medical home care, home modification, healthy meal delivery. There are a number of services that need to be organized in the home, and that's increasing in its use.
So when you say TIG infrastructure, is that a software program that's predominantly used by case managers and care managers for those organizations, or is there actual stuff at the home the patient is touching or the caregivers are touching as well?
Yeah, no, this is largely a platform and a network for care coordinators, social workers, care managers to be able to communicate and collaborate with their peers across the entire care continuum.
Right, fantastic. So you guys got your start a few years back, and I know that pretty early on you were doing some work with Jefferson and some others, but tell me a bit about how the company's developed.
Yeah, I mean, we were founded in 2015 after a pretty good success with Medicity, market leader in the interoperability space, bootstrapped for a couple of years, and since that time, we've been able to really bring on some marquee customers. So we're working with several leading health systems across the country. We're also working with several health plan aggregators around the country as well to organize these types of programs. So,
spit some names at me. Who are you actually working with?
So,
give me some ideas about what kinds of things you're doing for them.
Yeah, so I mentioned Redeemer Health System, Inspira Health, Jefferson Health, largely in the greater Philadelphia market around the hospital to home care transition program. But then on the health plan side, working with great organizations like CareCentrix, which is now part of Walgreens Health, PHCN, Health First out of New York. These are groups that are working with Medicare Advantage and Managed Medicaid programs to really coordinate care at home programs.
All right, excellent. So tell me a bit about the history of the company and the financing. You said you came out of Medicity way back when, but tell me about the sort of scale of the company, how much money you've raised, and where you are in sort of the trajectory.
Yeah, so I mean, we've raised a couple of rounds of funding, seed financing in 2017. Series A was announced in January of 2021.
Which was how much?
It was a $7 million Series A financing.
Which is probably very, very small for a Series A these days,
yeah.
Or maybe more like what we're going to see in the future.
Yeah,
back to normal, right?
Yeah. We've been very capital efficient, so maybe that's a little bit more in vogue now than it was a couple years ago. But we're also a tech platform versus a services platform, or a tech-enabled services platform. So we've been able to take that investment to really develop our platform, but also modestly invest in go-to-market and commercialization.
Right. And then how many people are you now?
Just under 40 people.
And what does good look like in a couple of years? How many more clients, how many more markets, how many more people?
I think we're operating in 20 plus markets around the US geographically, where we're coordinating care at home programs, north of 5,000 at-home care sites on our platform of service providers, and have grown 3 to 4x.
And is this a play that can work where you are with multiple of the same providers and organizations in the same area? Does it sort of turbocharge a network effect, or is it there you could be 3 or 4 competitors in one arena? Does that help or not help?
I think in this market, rising tide lifts all boats, and so I think if we have competitors, we're all trying to do the right things. So I think competition's good. It's healthy for the market, but you do tend to see geographic network effects around our business. So when someone happens to develop an ecosystem in region, the speed at which you're able to add health plans or health systems tends to pick up, and that creates a bit of a differentiated go-to-market position.
Fantastic. I'm talking with Ashish Shah. He's the CEO of Dina. Dina is clearly one of those companies helping sort out that messy post-hospital discharge, acute care at home stuff that we're hearing so much about, and trying to bring some sanity to the chaos. So, good job, Ashish.
Thank you.